So drugs trials, very common exam question in the biology. What comes up a lot is definitions. So what is a drug? So it is a substance that affects body, mind, personality. Okay, you don't need to know very much about what drugs are illegal or anything like that, but you might need to know what is a stimulant. That comes up, which is a drug that speeds up the nervous system. Whereas a depressant, can't spell, strangely enough, slows down the nervous system. There's one other category that might come up. So you've got depressant, stimulant. There is another one which is hallucinogen. And that changes perception, that one does. So that changes how you perceive your surroundings. Other things that come up, definition of a recreational drug, which is a drug that's not a medicine, basically. So it's one that's not taken for medicinal purposes. Okay, so that's a recreational drug. Pretty straightforward, all that stuff. The bit that people find harder, though, is the drugs trials one. Okay, so the way it works is that you have an idea. And then you use computers to work out a model. And then you synthesize your drug. Okay, so you end up with small quantities of the drug that you think might work. Okay, you then test those on cells and tissues in the lab. And that's really important because that lets you see a few things. Does it work? What's the lowest dose I can use so that it works? And any side effects. Once they've done that, they then test it on animals. First animal testing. And that's usually mice, because mice are quite like humans and they reproduce very quickly. And here they're checking dose. Does it work? Is it effective on the whole animal? And of course, any side effects. If that's okay, they do the second animal testing. And in this case, they do primates, like monkeys or chimpanzees. And that's because they are genetically very similar to humans. So what effects it will have on them will be the same as on humans, hopefully. Then they do something called the first clinical trial, which is always on healthy people. And the reason why they do it on healthy people, so not having whatever the illness or the disease was that you've actually designed the drug for, and they do it on healthy people just in case there are very nasty side effects, because healthy people, in theory, would be able to cope with the side effects. Then they do the second clinical trial on ill people. And they're looking for, does it work? And dose, is it effective? What the dose should be, and any side effects. Okay, if that all works, it gets licensed, and then it is GPs can prescribe it. There are, however, long-term monitoring for any side effects that could happen over time. sometimes asked about drugs trials is the placebo and the double-blind trial. So you can have this thing called a double-blind trial. And that's where neither the patient or the doctor know whether they're receiving the drug itself or the placebo. And that's to avoid any bias. Okay, so that avoids bias. Okay, placebo then, that is something that looks like the drug, often a sugar pill, and people then take it, think it might be the drug, and that's to eliminate any effect of the mind over matter. That's the placebo effect. And that lets you then truly see the impact of the drug that you are testing. Occasionally, you get a case study. The most common one that they use is something called thalidomide, which, if you remember, was originally a sleeping pill, but then they discovered it could be treated for morning sickness, and unfortunately that then caused birth defects. You can't even see the space now, no space left. And the reason why it caused birth defects was that they didn't actually test it on any pregnant animals. So it changed the law. So now these have to be tested at this stage. They're tested on pregnant animals, just in case it affects the unborn baby. Okay. Interestingly though, thalidomide is actually used to treat leprosy nowadays, but not to pregnant